Hi, my name is Brielle Smith. I am a second-year medical student at MUSC and a leader of the Community Vulnerability Project. Today's topic is when to come to the emergency department for COVID-19 concerns. I am joined by Dr. Dustin LeBlanc, an assistant professor and attending physician in the Department of Emergency Medicine and the medical director for emergency preparedness for MUSC. Dr. LeBlanc, thank you for joining me.
Thank you for having me.
My first question is, what COVID-19 symptoms are most likely to become severe over the course of the infection?
So while COVID can cause a large constellation of symptoms, the primary symptoms that we're concerned about have to do with the respiratory status of a patient. So specifically, shortness of breath is the one that causes the greatest concern, as it can indicate some decompensated respiratory failure.
And what are some reasons a patient with COVID-19 symptoms should come to the emergency department?
So any patient that's experiencing severe shortness of breath, blue discoloration, low oxygen levels, or chest pain should seek care immediately.
And what are some reasons a patient should not come to the emergency department?
So the majority of COVID symptoms are relatively minor and don't cause severe long-term complications. This can include fever, runny nose, sore throat, typical cold-like symptoms. Additionally, patients that are just concerned about exposure should not seek care in the emergency department. We don't do routine testing in the emergency department for patients with minor symptoms. So patients that are just concerned about having been exposed or needing to get tested should go through our telehealth platform at MUSC.care and then enter one of our many testing sites.
And Dr. LeBlanc, is it still safe to come to the emergency department for non-COVID-19 reasons, such as if someone were to break an arm?
Absolutely. In fact, we don't want people to delay coming in if they have a medical need, as some things can actually get worse if they delay their presentation. So for all of our normal operations, we encourage patients to come and please get evaluated if they're having something that's bothering them.
What steps is MUSC taking to isolate possible COVID-19 patients from other patients in the emergency department?
So we've had a systematic approach to minimize COVID exposure to patients and staff members alike. So compared to pre-COVID times, you may notice some differences when coming to our emergency department. For instance, you'll be triaged in a tent that's outside in order to get a temperature check and separate COVID symptom patients from non-COVID symptom patients. Additionally, you'll see some difference in the interaction with providers. People will avoid shaking your hands, people will keep their distance, and pretty much everybody's going to be wearing a mask, both patients and providers. And while the social interactions are going to be different, you can guarantee that the care is going to be the same.
Dr. LeBlanc, thank you so much for your time and expertise on this topic.
It was my pleasure. Thank you for having me.
And thank you for joining us for this segment of MUSC COVID-19 Community Outreach and Resource Awareness.